you come here for?
Everyone, this is Dr. J. Lemery.
Hello.
I'm excited to have this conversation because your last conversation we had here at EMA taught me a lot of things, especially the word fecal veneer. I don't know if you remember.
Oh, I do. Sure I do.
Yeah, like I learned a lot. We're all just sitting in it, just FYI. So this year we're going to talk. We're going to sway a little to a different direction and talk more about space, which is one of my favorite subjects to talk about. Now, before we do this, so introduce yourself and tell everyone what you do with NASA right now.
Yeah, so I'm a physician, emergency medicine physician. We started the Climate and Health program in University of Colorado, working with the Climate and Health Foundation. Our goal is to scale up a climate-savvy healthcare workforce, so we're really leaning into that. I'm also like a little ADD, so my background is in in environmental medicine. That's what led me to the climate stuff. So as another offshoot from that, a couple of years ago, I started consulting for NASA for long-duration medical spaceflight risk, and so that has become a thing unto its own. There is some climate stuff there, but they're kind of apples and oranges. So I think it's a clunky narrative if you try to bring them together. But you know, it's all one health, man. So let's riff and we can go back and forth between Earth and space.
Yeah. Well, so remind us what that idea is and what's the latest buzz in the world of climate and health.
So a couple things. One. At EMA, right? So thank you, Debbie, wherever you are. Right, you put our climate fellows on stage 5 years ago, and now those seeds are germinating. So they're becoming leaders in their own right. We're disseminating this idea that climate change affects health. We were just on a phone call this morning with the other half of the fellows. You met Gail and Nisha yesterday, and they're in Bonn, Germany, at the UNFCCC Intercessional. And they're doing work there. So these guys are now becoming leaders in their own right, moving the needle. And it's not crazy to say that your doctor will probably start talking about climate-related effects, just like smoking and exercise. It's a hot, there's a heat wave happening now. The air quality is horrible. You got to take it easy. Don't do your exercises in the middle of the day. If you're on oxygen, you may want to have someone drive you to the grocery store. So I think there's that. The other big buzz is that, and this gets a little wonky, but let me just try to make it fast for you. The healthcare is just under a fifth of our economy. The healthcare system is 8.5% of the national carbon footprint. So that's something that we have to look at seriously. Our first rule in medicine is to do no harm. And so we've leaned into that, right? And that's the right thing to do. It's a good thing to do and what we ought to do. But we know that people don't do the right thing always. And so now the sticks are coming. And there are billions of dollars from the federal government that prop up our healthcare systems. And that's going to start to be linked to sustainability metrics. And here's the thing, is that when CMS starts linking funds from the government to the hospitals, as they do for all sorts of things, we are going to need people to step up and figure out how to be in compliance and make sure that health equity is increasing and sustainability and decarbonization. And if you've just been snoozing up until this point, don't worry, these are jobs. So this is where it gets really important that we actually now are seeing an economic incentive to say, aha, what we've been doing because in finding funding to do it, now we actually are going to be able to have look at people and say, this is a job for you. Please do this because the world needs it. So I think that those are kind of the big updates from the climate world.
When money comes into play, all I can think of is how much corruption can also come with it. So, I mean, is there things in place to watch where this government funding is coming from?
Yeah, I will say that when it comes to CMS dollars, those are high transparency transactions, and there's tons of hands-on and eyes on that. So that I think is probably, well, it is what it is, but I think that it's going to be high profile. Undoubtedly, though, these shifts, right? There will be malfeasance occurring, but there's also huge opportunities, right? So now innovative companies can be like, hey, we can solve your carbon problem. You know, that's a thing for us. And they're going to get funding and figure it out. So I think we're finally seeing things are moving in a way where they've been jammed up for the past several years because there's just been no money to do it. And no one is like, well, I'd like to do it, but I have to, you know, make money and stay in the black and all these other things that.
And I mean, we were talking backstage, when it comes to government, things are a lot slower, you know, to progress. And to me, it's going to take the private sector to really kind of move us faster in the right direction. How do you see that role with the government, these private sectors coming with the government? How do you think that's going to work?
Yeah, so the government generally, when it's working well, the government sets the rules and sets the parameters, but then says like, we can't hire all these people, we can't figure this out. So then they provide these grants, and that's one of my big takeaways. Also from the COP conference is that there's a lot more money being mobilized, at least on paper. Big announcements. Haven't really seen it trickle down yet, but so the money is there. And then here's something that the government can absolutely not do, but the private sector can, which is artificial intelligence. Now, we've been living in the world of big data, right, for 15 years. Think Facebook, like the aggregation of data. So the data that's been collected on us is massive. What hasn't really happened is that we really don't know how to process that data. There's no efficient way to do it. It's just so big. Artificial intelligence now is changing the game, right? Because then it can sift through big data, find linkages that we would have never imagined, separate what we call signal from noise, and say, aha, you know, if you, for instance, for thinking about a hospital, if you go remote clinics on Tuesday afternoons, for instance, you will increase your health equity because people will be able to get to your clinic without having to drive in. The carbon footprint will be less, and your reimbursements, you know, whatever, maybe stay the same or go up. So that's an example where if AI can start to do data-driven strategies to convince hospital CEOs, be like, this is the thing to do. Whereas before they'd be like, listen, I want to decarbonize, but I don't know how to do it. And if I lose money for 1 or 2 quarters, like I'm out of a job. So, and they have no confidence. So this is where I think this is going to change. And I think this is exactly the type of thing where the government provides grants to do this. But more importantly, provides the incentives. If you don't do this, we're not going to write you that big fat CMS check, you know, Center for Medicare Services, right? So that's going to be the thing where now they'll be able to, you're incentivizing the marketplace and allowing, you know, allowing the private sector to do what it does, which is innovate.
It's all about that money. All right, now you were talking about COP 28. You just were at in Dubai. Can you explain what COP is to everyone?
Yeah, COP it's like the Super Bowl of climate everything. And it's the Council of Parties. It's an antiquated name. It's the 28th version happened last year. And it was in Dubai, you know, that very green city, which is, yeah, so it was a place where, you know, everyone kind of comes together. World leaders come at the beginning, and then all the different sectors come together. And we were there with the health sector, and it took them 28 years, 28 iterations of this thing to be like, hey, we should probably have a health day, don't you think? So that's what came through. Interestingly, I talked about some of the things I took away from there. One of the big things is that the kids are pissed off. And bravo to you, Debbie, and Emma and Asher for having a youth movement, because you're capturing what is exactly what is a movement within the world, which is this next generation is very vocal, they're very active, and they're getting angry. I would say maybe 5 years ago they were curious. Now they're angry. And they're actually picking an enemy where maybe we've had a détente up until this point, but they're pointing at oil and gas and saying, you are not just what we have to live with, but you are actually now evil. So it's interesting to see the change where oil and gas is now being actively called out as a, you know, as a not in good faith player, if you will, for these solutions. So that's something that I think really bubbled up this past year at COP.
Well, let's talk about planetary health. Can you explain what planetary health is, and and how you're helping NASA in this area.
It's great. Finally, let's get to the space, the cool stuff.
Yeah, we get
Planetary
the
health
space
is, interesting, we talk about climate and health, and I think we have to. We have to focus on climate change because it's a specific thing with specific solutions. But there's a larger paradigm called planetary health, which is like, hey, we're all part of one grand organism, right? So, we have ecosystem services. What does the environment do to keep itself in check? There's issues around pollution. There's issues around biodiversity and other species, right? So this is where kind of COVID has that intersect where, we've got animal diseases skipping over to human diseases for, I'm not going to mention the last week's news, but for all sorts of reasons. So that's planetary health. It's really it's a larger concept, and I think a lot of students a lot of educated medical schools and so forth are gravitating towards that model. As I said before, my version of planetary health is climate and health, and then as a project that's been sort of my career trajectory is working at NASA for long duration human spaceflight risk.
Do you know, there's a lot of space waste out there. Does that affect our climate at all, or will affect our climate in the future?
That's a great question. I don't know. I think the usual attribution, right? If it's carbon intensive to launch a rocket, and what does that do? I think probably more concerning is like this stuff stays up for years, decades, and centuries, and it's not always so it's up for 100 years. It's there, and there's more of it. So I think it was I forget the movie where things start blowing up with the space.
Again?
No, all the litter hits the space station. Sandra Bullock.
Oh yeah. What was that?
This is the right
Gravity.
part. Thank you.
Yes.
Yeah, it was amazing. That first scene was like phenomenal, amazing, and that's I think what keeps up many of us that work for human spaceflight. Yeah.
What are the biggest risks for the moon and Mars?
Yeah, so I think so think about the way we've designed astronaut health for the last 7 years. Keep Apollo over here. That's the moon, right? It's 250 miles up. If anyone gets super sick, they can come home within a day. There's a lot of material there on the space station, and they have pretty much seamless communication with ground support and just whatever you need. The moon is 10 times the distance. It's further away. It's going to be much more difficult to come back. There's communication latency, right? So you can't have the bandwidth to send images back and forth. There's a little bit of a delay. So, then time-sensitive communications, that could jam things up. Mars, even more so. There could be 20-minute delays. So if you have a medical emergency, we have to kind of think about that, right? There's radiation, deep space radiation, that we don't have to worry about here because we're protected, and even low Earth orbit is protected from the magnetosphere of the planet. But moon, no. Mars, no. So there's that. There's bone demineralization, bone risk. How do we keep our musculoskeletal healthy? And then the big thing, which is like, the Mars missions are 3 years, right? How are we going to not all go bonkers and beat each other up and have horrible dynamics emerge?
Space madness, it's real.
So we've got to figure out how do we protect against that?
Now, it feels like there's rockets going up every week now. So how are things changing with the commercial space program?
Yeah, so, and then Boeing, I don't know if I just saw this sitting over here. Yeah, went up this morning, right? Super exciting. So more and more players are entering. I went to a conference, it's called Space Symposium. It's in Colorado, and it was in April. And the amount of businesses scaling up and leaning in for all sorts of commercial spaceflight, but getting space tourism and putting up space labs and space stations is phenomenal. I mean, I'd probably say scores of companies are there doing it. Which part, Debbie? Yeah, I'm going to hand it over to the tourist, the original space tourist.
Yes, indeed.
It is real. It's just like most things, it's money, right?
It's all about the money. And like when I started with space tourism 20 years ago, it was with Russia, and it was because the government couldn't afford to put the Soyuz up. anymore. So they were relying on private citizens to help fund their program. So that's how it all kind of started. And even today, that's, it's all about that money. So we have a lot of billionaires out there that are going to help fund this private sector. Yeah. Which can be a great thing, can be not so great of a thing, but at least it's progressing us faster than I think the government can do. Yeah.
The NASA is, again, this is sort of what the government ideally does, right? Which is it incubates an industry, and then when it can hand it over to the private sector, it does. So now NASA is really looking for Moon and Mars and low Earth orbit, at least for human spaceflight. They're like, you guys got this, SpaceX, Boeing, and a lot of the derivative companies that will use SpaceX to get there. So, NanoRacks or Vast. Vast is actually hawking a honeymoon suite in its space station that it wants to put up there. And it may sound kooky, but people will pay for it. The cost is coming down. And there's also the niche that the space station fills right now is the space station decommissions in 2030. So 5 years from now, the space station's over. It's just antiquated. It's old. I think there's lots of reasons for it. There's the risk of things actually falling apart, and then it's also the commercials are going to be able to fill this niche. So they are, and so there's several plans for launching smaller, bespoke space hotels or space labs and things like that. So I think we were talking about this backstage. Your ability to go up in space is going to be very real in the next 10 to 20 years.
I hope so. I trained a long time to do this. I better go at some point. Let's open it. We have time for maybe a couple of questions, but does anyone have a question for the doctor here?
We usually offer this spot to Alex, but I think she's not
where
here.
is Alex?
So I always have questions.
What is it?
It's anyone got a thing they want to?
I have a couple of questions.
What is it, Ash?
Thanks, buddy.
Speaking of this sort of space tourism thing, what is that? Sorry, I have a big voice. Don't worry about it. Speaking of the space tourism stuff, so what does that look like? Is there a travel agent? Like, how does that work? Do you get a package with the flight and the hotel? I mean, what is the situation?
Yeah, I may ask. I'll start and then hand it over. But it's basically if you're interested, email us, and then they get back to you with tell us about yourself. Are you serious? Are you not? And the cost, 7 to 10 million. It feels like that's what's been floating around for retail. Now there's always other circumstances. I think. It's they're gunning for that, right? Because these are going at first they'll be high net worth individuals, right? So it's going to be high thread counts, concierge service. It's all the usual things because that's what people will pay for, and they want to feel that experience.
Same question. Yeah. Fully.
And a lot of these space tours also get put to work. It's like a lot of these people are going up, having fun and floating around, but there's missions like my mission was going to be going to the ISS for 10 days, and I had environmental studies I was doing. I was doing work up there, and that was the only way back then that you could go to space is you were put to work, and that's still happening today. A lot of people are going up to space to work on different missions for different companies, medical companies, things like that, and people will actually pay to do that work for them.
Wait, so just one question, then I'll let other people. But so when you say you're going up to space, do you get out, or you?
Yeah.
Out of the space station?
Yeah.
That's a spacewalk. We don't do that. That takes years to accomplish and train for. But no, I did not train for a spacewalk at all.
So you don't get to spacewalk. You're all in there.
You're in this little.
You're in it, but it's
tight little tunnel
but it's
for a while.
luxurious.
It's not luxurious. It smells. It's
Okay.
not comfortable. You're having to use the bathroom in front of your peeps.
And we want to do this why, Lance?
Well, for the greater good, yes, for the future of our planet. That's what we do it, Debbie. But yeah, it is not a comfortable ride. I remember in the Soyuz, which a lot of people, if you don't know the Russian Soyuz, it is very tight. It is not our shuttle, which is a very luxurious ride. But you're, with your an engineer here and your commander there, your knees are in your chest. You can't feel the bottom half of your body after an hour. And it takes 2 days to get up to the ISS. So you're stuck in this little bitty thing for 2 days, just waiting, twiddling your thumbs. Again, smells horrible. Holding a funnel for your commander as he goes number 2. Talk about fecal
That's the
veneer.
fecal veneer. There we go
There's your
again.
fecal veneer.
How long did you train for?
I was there for half a year. Yeah. Star City. Good times. It was scary, but one of the best moments of my life. Because as a kid, I dreamt of being an astronaut. So to be able to work with the same exact people that put Yuri Gagarin up in space, that made his suit, that trained him, they're all still there in Star City. Nothing has changed. And it's just, you go back in time. You go back to the 60s, and that was just an incredible experience.
We have a question here, Lance.
Oh, yeah? Go for it.
So
Voice of God.
Oh, over here, way
Oh.
behind. So since this is kind of like a really interesting frontier for the future, how do you envision like a more equitable opportunity moving forward for folks that might not have, the ability to have like $70 million to go up to space, but are very interested? So yeah, would love to hear like what your future vision is for making it more accessible to all different walks of life.
Yeah, great question. Interesting, the Europeans are really leading this conversation where they're flying a para-astronaut, so a paraplegic person. Now, these are exceptionally well-trained individuals. But in the culture of NASA astronauts, right, this was sort of not assumed to be a great idea by everybody, but they're going to do it. So there is a sense of like this has to be, a space for all mentality. And so there's conversations about that. Economically, I don't know how that would work. I would imagine like most things like this, once it kind of reaches a level of maturity or growth, those net worth individuals subsidize, a scholarship type thing. But I don't know. But the para-astronaut I think is very interesting because it's opened up a lot of conversations where there's some of the comments you're like, did that person really just say that? But so I think again, great question.
Have another question here.
I just want to start by saying I am from a total space family. My dad was an aerospace engineer. I am space all the way. But I'm really worried, especially when I think about sustainability, in things like the commercialization of space and how that's going to be different in different places. And so how do these efforts interleave with NASA and Caltech and Boeing and other space programs around the world so that we don't turn into, Elon Musk kind of opened the Pandora's box. When we look up into the sky now, we see a track of his satellites, and those satellites are going to continue to grow into the 20s of thousands in our lifetimes. So our night skies completely changed, which is devastating to me. So how do efforts like this make sure that there are conversations happening with the larger space community, not just the commercialization in America community?
And who's allowed to police that? And how do you police that with all these countries going to space, especially countries that do not get along and want to use it for bad?
That's right. Yeah. So Space Force, right, was just created 5 years ago in the U.S., right, and that is definitely a military challenge to adversaries. I'll say this: the simple thing of, hey, shouldn't we all kind of share best practices around astronaut health and mutual aid, or at least sharing databases so we know if somebody has a medical event, it should be reported, just like we do with cancer registries or basic epidemiology. And that has been a difficult conversation to start. So NASA does have a sustainability mission embedded within it. I'll just speak frankly, I don't see them being having a heavy hand in these things. And with commercials, forget about it, right? They're all private. So I think it's going to be a long time before that gets reconciled.
Well, all right, guys, that's all the time we have for you. Thank you so much, Doctor, for joining us again. Always love talking space.